So, red light therapy, or RLT, it's pretty much everywhere these days, right? You've probably seen the glowing panels, the masks, and you've definitely heard some of the big claims. In this explainer, we're just going to cut through all that noise. When something is marketed as a fix for everything, it's natural to be a little skeptical. And that's fair. So let's just put the hype aside and really focus on what the evidence actually supports and where the practical applications are. All right, to do that, we first have to understand what's actually going on inside your cells. It's not magic, it's just biology. Okay, so what is red light therapy? The key thing to get is that this is not a heat lamp, and it's definitely not a tanning bed. It uses very specific wavelengths of light that act like a set of instructions for your cells, telling them to kickstart their natural repair and regeneration processes, all without any damaging heat or UV rays. Now, there are really two main types of light used here. On one side, you have red light. Its wavelength is a bit shorter, so it works right at the skin's surface. This is what you hear about for things like collagen production or wound healing. Then you have near infrared, or NIR. It has a longer wavelength, which lets it penetrate deeper to reach muscles and joints. That's why it's used more for recovery and inflammation. So how does this actually work? Well, it all comes down to the mitochondria, the power plants of your cells. Specific light photons get absorbed, and that stimulates the mitochondria to produce more ATP, which is basically the energy currency for your body. The result of that extra energy is less inflammation and better tissue repair. Think of it like giving your cells a very targeted recharge. Okay, so now that we have a handle on the mechanism, let's look at what the research actually says. This is where we separate what we know from what's just being claimed in a marketing email. So in one controlled trial looking at muscle recovery, participants who used RLT saw a 25% greater strength gain after their training. And in that very same study, they also reported a 30% reduction in soreness after exercise. So when you put those two numbers together, you can start to see a pretty clear picture of how it could apply to athletic recovery. And what about pain relief? Well, some studies show up to a 32% reduction on what's called the visual analog scale. It's just a standard way to measure pain intensity. It is worth noting, though, that the effect here can really vary depending on the person's condition and the specific protocol they used. This chart kind of sums it all up. As you can see, the evidence for things like skin health, wound healing, muscle recovery, and certain types of pain relief is pretty strong. For hair regrowth, it's more moderate. But then you get to claims like longevity extension, and the evidence is, well, it's weak. The hype has just gotten way ahead of the actual data on that one. So, the evidence points to some real benefits, but what about the tools you use to get them? Let's take a look at the difference between the devices you can buy for your home versus what you'd find in a clinic. The main thing to know is that they're really for different purposes. Home devices have a lower power output, which makes them safe for you to use every day, and they're great for building consistency. Clinical treatments, on the other hand, deliver a much stronger dose, so they're better suited for acute conditions, and they're always done under professional supervision. If you're thinking about getting a home device, these are the 4 questions you should ask. Any vague claims are a bit of a red flag. A good device is going to tell you the exact wavelengths and the power output, or irradiance. It should also give you a clear protocol to follow and, of course, list any health conditions that might be a problem. Because, having the right tool is really only half the story. Getting results from RLT is all about using it correctly and, probably most important of all, consistently. So what does that look like? Here are the fundamentals. We're talking 3 to 5 sessions a week for about 10 to 20 minutes on each area you're treating. And please, the eye protection they give you is non-negotiable. Always wear it. The main principle to remember is that consistency is always more effective than intensity. Doing a few shorter sessions every week is going to get you much better results than one really long session once in a while. This also means you have to be patient. You'll probably start to feel benefits for muscle recovery or pain within the first 2 or 3 weeks. But for skin changes, which depend on cells turning over and new collagen being produced, well, that just takes more time. You'll need to give it at least 4 to 8 weeks of consistent use to see those visible changes. So let's just pull all of this together and put red light therapy in its proper context. Here's the bottom line. The real value of RLT is in specific, targeted applications. The evidence is definitely there for using it to manage pain, improve your skin, and speed up muscle recovery. The other, more exotic claims, They just aren't supported by the science yet. The technology does work, and the benefits are measurable. But you only get to those benefits when your expectations are lined up with what the evidence actually shows. And that really brings us to the final thought here. After all this talk about wavelengths and devices, the biological processes that RLT helps along, they all depend on a regular, consistent stimulus. The technology gives you the input, but it's the habit that unlocks the results. So the question I'll leave you with is a simple one. Is consistency the variable that you're missing?